Jim has a wonderful command of pediatric oncology, how to make a diagnosis, how to treat it, how far our knowledge extends, a scholar, if you will. He has a winning smile and a sparkle in his eye that makes you want to be next to him.
He's famous for the disheveled professor. Shirt tail out, hair might be standing up in the front. Families, the children love it. He's so approachable and easy to communicate with, easy to talk to. He's very passionate about what he does in all things in life. Jim has a respect for what each person brings to the table, and that shows in how he communicates with people. I think that his passion for the patients and families that we care for is obvious, and he realizes that that takes a team.
Our first experience with Dr. Whitlock was in the old hospital on the surgery floor in the formula room. And that's where he took us to tell us she had rhabdo. He was just so down to earth, and he just exudes this sense of trust that you know that he cares about your child and he's going to put them first. Is that when your hair fell out?
What was it like when you lost your hair?
Just like it fell out, like coming out. It was like I'm shedding like a dog.
He and I felt our responsibility not only to cure when possible, but also to support those children and their parents going through very difficult times, to help them respond to tragedy in a way that would not destroy their lives or erode their quality of life. That's Jim.
Jim has always been very passionate and very involved in the Children's Oncology Group and other groups internationally. He cares very much about the clinical care he delivers, but very involved in the research and science that hopefully will cure children with cancer one day.
I think you have to credit them as a team, but the team is usually as good as the leader who leads them. So when you credit the team, you're crediting his leadership.
His patients love him. His staff admires him. He has helped many a child and many a parent through very difficult waters.
We always knew she was in good hands and that they took each decision about her personally. It wasn't just a number or a diagnosis. They looked at her as a little girl that they came to love, I think, and that they wanted to see do well.
He made sure everything was checked and everything was perfect. Just always, very kind.
From day one to the day he could say she was cured, he's been there every step of the way. He never let us down.
He is a beautiful human being with a wonderful wife and wonderful son. I'm very proud of Jim.
I don't know how you thank Dr. Whitlock enough, because I don't believe without him and the rest of the team that he built, she wouldn't be here. I truly believe this place is a piece of heaven that God set down on this earth so that we would have her. So we are thankful for Dr. Whitlock and his team every day. And we don't ever forget to be thankful for them or what we have. So thank you.
Just thanks for everything. It's, wow. He helped in so many ways that I cannot even describe. Just huge, huge, huge thank you.
I'm very excited to see everything else that he accomplishes in his life, because there's going to be more to hear about Jim Whitlock.